First, as the debate rages over the troubled rollout of the Affordable Care Act, companies offering health insurance through the Obamacare marketplaces are working to build awareness of their products, inform and enroll individuals and small businesses. Joining us this morning is the CEO of Ground Healthcare Cooperative, one of 4 health insurers serving the Milwaukee area through the AFA. Robert DeVita, welcome. Good to see you.
Good to be here, Michael. Thanks for the time.
Last week, HHS Secretary Kathleen Sebelius said that it's been a, quote, miserable 5 weeks since open enrollment began. What's your assessment of the rollout of Obamacare?
Well, we always thought it was going to be a soft launch, meaning that there's a 6-month what's called open enrollment period beginning October 1. Soft in terms of that there's not a hard date because things don't happen right away. The first hard date is December 15th, when if you've enrolled and paid your premium, you'll be eligible for insurance January 1. The next hard date is March 31st, when open enrollment closes. So we always thought it would be soft. We didn't know it would be this slow and this, as she said, miserable. Now, on the other hand, Ground Healthcare Cooperative has a unique place in this marketplace. So we've used this time to get our name out there and create awareness. And that's why I'm so glad to be here, because our aim as an organization that is of this community is to get people to understand how we're different and why we're such a good buy.
Well, let's talk about how you are different. Sure. Common Ground, one of 24 throughout the country, consumer-operated and oriented plans, or co-ops. Yes. How does a co-op differ from a private insurer?
That's a great question, and I would just go to the heart of Wisconsin co-ops. And I lived 22 years up north, and I was in Marshfield, Wisconsin, with Marshfield Clinic. And one of the things that I got to understand was I bought my gasoline at the local co-op, Cenex. We bought our dairy products at Land O'Lakes. Ocean Spray Cranberry, for cranberry, was actually Warren, Wisconsin. Their headquarters in Wisconsin is right in our service area, and they were one of our accounts. And then, of course, credit unions are huge in this state. There are co-ops, in addition, in Milwaukee. There's the Outpost Foods Grocery Co-op. There's the Willie Street Co-op in Madison. There's the Group Health Co-op that's been around since 1976 in Madison, providing health care to 72,000 people. So co-ops are sort of a business model that's been around Wisconsin for centuries, for decades, not centuries. And as a result, the difference is known to people. They are local, they are not-for-profit, they're for-benefit organizations. That's what they're called, for-benefit. And the benefit is for the members. So members are people who buy and use the product. So if you're a member of Ocean Spray Cranberry, you're buying the product. So producers are making the product. They're the ones who are members of the organization. In our organization, it will be the people who own the insurance, and they'll be eligible for the board of directors, and they'll be our governors. Our governance will be provided by members. So that's a key difference. So that what we do here in terms of the impact on them directly is felt by them, and it's directed by them.
Common Ground Healthcare Cooperative is new, and yet Common Ground has been a name that's been around Milwaukee for a long time.
Yes.
Tell us about the differences between the two.
Sure. Common Ground is our sponsor, and they've been around since they started studying in 2006 what they could do as a civic organization of common citizens to help improve life here. I got involved in 2008 when I was working with Wheaton Franciscan Healthcare, one of the founding organizations, and was very impressed that they had developed 3 areas at that time. One was the housing situation in terms of foreclosures. One was health care for small businesses and individuals, something that I'm passionate about. And the third area was to be defined. First it started out as jobs. They did a jobs initiative, and now they're on to another initiative working with the Bradley Center folks. But my space, where I was a volunteer, was in the area of developing ideas around how to provide better health care, more affordable health care. And then, so that was 2008. 2010, I actually retired from Wheaton Franciscan and was a volunteer. And we had this idea that we could apply for a federal loan under the Affordable Care Act, which had just been passed. So we did a lot of work as volunteers And Common Ground provided a lot of the volunteer work as well. And then a large number of the rest of us did as well. So it was sort of like sweat equity.
You received a federal loan, $56 million,
Yes.
to get this
Yes.
going. But there are limitations, though. You
Yes.
can't use any of that money to market
Yes.
Common Ground, and you can't go after the big companies as well.
Right.
Does this put you at a competitive disadvantage to some of the other insurers who are trying to enroll people in the Milwaukee County area?
Not really, and here's why. We've always been focused on not the big companies. So that's not an impediment at all. We've always been focused on the small businesses, smaller nonprofits, individuals like entrepreneurs, independent contractors, freelancers, and the newly insured. You know, so that's never been an impediment. The other aspect of it is the definition requires us to be creative. So, for example, we have a large ground game, an army of volunteers who go out with flyers, and they blanket. We can't buy advertising on the Packer network or something like that, like the mainstream insurers can. So we've got to do it the old-fashioned way.
It's grassroots type of
grassroots, foot. People on foot, and literally on foot. We go to parishes, congregations, synagogues. I was at one on Sunday afternoon, 55 people in the basement of a church, and that's how we are doing it. And the word of mouth is spreading. Plus, we've got a terrific website. We've had a lot of donations too, a lot of pro bono work done, which is terrific. We've got a great community here in southeast Wisconsin.
What have been the results here? We're about a month and a half into the open enrollment. How many people have actually enrolled or been able to enroll?
Yep, 236.
236.
And what's interesting is the trend, because as of October 31, when I was asked the same question, it was 142. So in a month, 4 weeks, it was 142. 5 days later, as of yesterday when we did the report, it was 236.
What percentage have enrolled not through the healthcare.gov website?
Yeah, about 30% is coming what we call off the exchange. And we've always been designed from the start in our business plan. In 2011 when we wrote our business plan, in 2012 we got funded. We've always been focused on it's going to be both on and off the exchange. So that was sound thinking at the time, and it's even better now with the problems. So we're selling old-fashioned way. We've got a terrific crew of brokers and agents, 350. And remember, we're in 19 counties now. We expanded, and I'll talk about why we did. So that's one way that, and by that I mean old school way, that's the way it's been done for decades. Health insurance has been done. Another way is, a new way is online to our website. You can go online, get a quote, you can actually enroll, and people are doing it. And we're told by consumers and by our brokers and agents that we've got a great website. You can also ask the website to do an estimator if you think you're eligible for a premium subsidy tax credit. Now, we can't vouch for that because it's an estimator, but then people can take that and they can go to the exchange and they can apply on the exchange. And once that's working better, it'll be better for them.
Very good. Our eye this morning is on Common Ground Healthcare Cooperative. We'll continue our conversation about the Obamacare rollout with Robert and Vita in just a moment. Stay with us. Welcome back. The president and CEO of Common Ground Healthcare Cooperative, Bob DeVita, is our guest this morning, talking about the Obamacare rollout and where we go from here. Let's talk about your coverage area. You start in southern Kenosha County all the way up to northeastern Wisconsin as well.
Yes. When we applied for our loan, we applied for the 7 counties in southeast Wisconsin because that was really where we thought we'd be able to start. And then we said, in our 5-year projection, that we would expand the service area. But when we negotiated our contracts for the healthcare providers, we contracted with 2 organizations. One was an integrated healthcare network called Aurora Healthcare, and they happened to be in these counties along the eastern seaboard from Kenosha all the way up to your hometown of Marinette. And as a result, we picked up the 2/3 of the state of Wisconsin is potentially in our service area. Trilogy is the wider network and includes other providers as well as Aurora. and they are likewise in the 19-county service area. So we picked up, again, that 19-county service area. And what's really important for us is that brings us into a population that will give us a heck of a lot more coverage. And you're into towns that you know very well: Appleton, Fond du Lac, Manitowoc, Green Bay, that are very strong. They're very strong economically, and they're very in need of alternatives for health insurance, just like Milwaukee area.
Common Ground has a goal of, what, 10,000 members by the end of next year. Given this rocky start, is that attainable?
Absolutely. And I liken it to, my passion is football, and I liken it to, we're early in the first quarter. We've just kicked off, and we've gone through a few series, offensive series. So if I'm asked, how you doing, I would say, well, if we keep playing this way, let's say we had 2 great series. If we keep playing this way, we'll be in good shape. If we had a bad series, we won't do well. We got to improve. So we've had a couple of bad series here, so we got to improve.
There are some Senate Democrats, though, who even say, okay, using that football analogy, maybe we should postpone this game and play it another day. Let's shut this down, get it fixed instead of fixing it on the fly.
Yeah, and actually, because I prided myself, I'm not a politician. That's for the people that we've elected to have a policy discussion about, and that's for them to decide. They're our elected representatives. What I have to do as the CEO of this organization is play the game with the rules that I'm given, just like in football. You create your game plan based on how you've been given the rules and what the other team does, and then you have to adjust and adapt to prevail, and that's what we're doing. So the slow rollout, we're doing other things. We're telling people Common Ground is open for business. You can come to us through brokers and agents. Come to us through our website. You can call our direct sales center. You can go to one of our many community meetings and find out all about us.
Will your members have the kind of health care they need come January 1st?
The ones that are enrolled, absolutely, yes, they will. We're looking at data. We're looking at numbers, not just anecdotes, not just stories. Those are important, but you got to look at data. And our trends are that this is doable. This is doable.
Bob DeVita, Common Ground Healthcare Cooperative, good to see you. Thanks for stopping by.
You're welcome, Michael. Pleasure.